Hello, and welcome to Be Inspired on this wonderful Sunday. So, I want to say that I'm going to start initiating Sundays with Munica. And on Sundays, I'm going to just, invite others to talk with me about different topics that, we may have encountered throughout the week, or something that we, off the wall may want to know about. Today's topic is going to be about early detection of illnesses that can be prevented for our elderly and disabled. This brings something very dear to me because my grandmother, she had spent her final days going through dialysis and such things. But I truly believe that if she had taken advantage of the benefits that she had with having Medicare and knowing what those benefits were, that a lot of things that occurred could have been prolonged with early prevention. And I say prolonged because sometimes things happen that are out of our control that providers cannot stop. But then there are things that, if early detection is made, it's preventable. So that's what I want to talk about today. And that is preventative services and making sure that people talk to their family members, especially our elderly family members or members that are disabled with some type of disability. And that brings me to say that if you know anyone that has Medicare, for example, Medicare has many preventative services out there that if you are going to a primary care doctor, that doctor should be well aware that Medicare has preventative services. One being the Welcome to Medicare, that starts for any elderly person or disabled person when they first get Medicare services. Then after the Welcome to Medicare, there is the initial Medicare wellness visit. After the initial is the subsequent. So in these visits basically gives an idea to your provider as to what may be currently going on with you or not currently going on with you. So there's like a series of questions that you're going to be answering. And then based off of those questions could be something else that will be identified that your provider should be taking action on with you and any other family member that's going to be involved in your care. So, for example, had my grandmother gone into her to see her provider, and maybe she did go see her provider, and the provider was not aware that these things are out there for their patients. So we have to make awareness to the providers, and we have to make sure that there's awareness to those members that are receiving Medicare benefits. So Medicare does an outstanding job with trying to get the word out to providers and trying to get the word out to the members. But a lot of times those things go dormant. And I'm just looking from a perspective of being on the back end with having family members, and then I'm looking on a perspective of having to be in the world of healthcare for over 25 years. So what I've noticed on the family side is, the elderly will get tons of mail, and they don't open their mail. My grandmother probably received, and actually, I take that back. A lot of times back about 10 years or so ago, there wasn't a lot of information out there to members, honestly, that were saying, hey, you have Medicare and these are your benefits. Make sure that your provider is doing X, Y, and Z. Nor was there any type of information going out to providers saying, this is what you need to do to make sure that your patient is getting the best quality of care. So let's move forward, because we're not going to hold anyone hostage for the things that did not happen in the past. However, moving forward, I must say that there is tons of information that Medicare is, sharing with the providers that they need to do for their patients. There's tons of information out there that is going directly to the members from Medicare that is telling, the patients, these are the type of services that you are able to receive at no additional fee to yourself. Some of them may have a copay, some of them may not, but the copay at most is about $8. And we'll talk about that $8 copay. But then if your family member or someone has a secondary insurance, like Medicaid or something else, that secondary insurance is going to cover the expense, the 20% that Medicare does not cover. And there's nothing that's going to be an out-of-pocket expense. So it's a win-win. Health is the new wealth. And we all want to be healthy, not only in our body, but also in our minds. So back to the preventative services. One of the other preventative services that I want to talk about is depression screenings. So the depression screening, for example, if my grandmother would have gone into her provider, say we're talking about right here and now, if she was here and she went into her provider and her provider says, okay, you have active Medicare, you have a secondary insurance, we're going to do your initial annual wellness visit. We're going to ask a series of questions. And one of those series of questions is, a depression screening assessment or a depression assessment. So that's going to be a question that follows into other questions depending on the answer that is given from the first question. So if my grandmother said that she was not depressed, it doesn't go any further. But if she says that she was depressed, it's going to go into another series of questions. And the action out of that from your provider is, okay, how do we get her help for managing her depression? And it could be depression for anything. It could be depression from getting older, or maybe as she got older, things became more challenging and difficult to do. So that made her a little depressed. And it doesn't mean that because she's a little depressed that something is wrong, but the provider should be looking at it as to, okay, how can we help assist? And a lot of times providers are already helping to assist for the things that Medicare says that they can do as a preventative visit, but the providers don't document. The providers don't bill for it, or the providers aren't getting the patients the help that they need to have to be whole. So then another example that I will give, I talked about the Medicare annual wellness visits, and that with doing the annual wellness visits, something may or may not come out of that. Another thing that could come out of that is if the person is eating properly. So there could be a medical nutrition therapy that, this patient may need. And I'll use my grandmother as an example. If she did a Medicare wellness visit, it would indicate that, she's eating very well. However, she has a high content of sodium, which is making her blood pressure high. And how would the doctor know that? Because of the series of questions. What are you eating? And my grandmother would have said something like, oh, I eat fried chicken, or I'm eating, I use a lot of salt. And those key things could identify to bigger problems and prevent bigger problems from happening. So that provider at that time would be, able to share with her, we need to cut back your salt intake. We need to do X, Y, and Z so that we can prevent you from having high blood pressure. So that's another example of why it's very important for people that we know that are elderly or disabled to, see their provider and make sure that these preventative services are received, because there's lots to be gathered from these preventative services. Another example I can give is making sure that men have their preventative screenings as well. It can detect prostate issues, urinary incontinence issues for men and women. There's so much that I can only, wish that had we known before, we could have prevented so many deaths from happening. And it's blind. It's like mind blowing, because there's so many things that could have been prevented just off of knowledge, just off of educating others as to what they have available to them. Another thing that I will share is, even with these preventative screenings, there's one for alcoholism. So if you go to the doctor and you get your screenings done, and they, inquire about the amount of drinks you have, that will determine something else that could be going on. And it's vital. It's key to the next thing that may be happening in your life that your provider can help prevent. Colon cancer screenings. Another key thing that, if you just go to your provider, and if your provider is aware to do this, can save lives. I will not, take up too much of your time, but I just wanted to, share these things with you today. Make sure that you are being visible in the lives of the people that matter to you. Ask them if they've been to the doctor. See if you can be a part of that experience. Can you help? Can you share knowledge? Because some of these things that are going on can be prevented, you know, and it's not about your doctor, trying to, you know, charge you for something more or trying to charge your insurance for something more. It's about what's available. It's available. It's been made available through the government. It's been made available, for you to get the best health care that you could possibly have. So if it's there, why not take advantage of it? Save a life, you know. Be vigilant for yourself. Be vigilant for the ones that you love. And make sure that you are getting all the services that you could possibly get. I mean, one key thing also is diabetes screening. What's your A1C level? If you have an issue with diabetes and you're getting, your preventative screenings done at your provider's office, then you and your provider is going to have a great care plan for your diabetes, for your hypertension, for the next time that you show up to see your provider. Your provider should be giving you something to document your A1C levels while you're home. And, if you don't do it manually, there's so many things out there like remote patient monitoring that can access your blood pressure, your weight, your A1C level, and report back to your provider. That way, there's collaborative care. There's things that are out there that are phenomenal to, make sure that one provider talks to the other provider and then bring you in and other family members in on that conversation so that you are a part of your own care. Take advantage of it. It's there. It's something that it's something that's needed. It's something that's needed, and it's something that's going to help you give yourself the best quality of care, and it's going to help your provider coordinate your care for what is needed for you. So again, be inspired to be inspired. And until next Sunday, take care.